Hey everyone, welcome. This is Jason Clemens, Doctor of Chiropractic at the Rock Health and Wellness Center, and this is Life with Jason Clemens, DC. We are live right here from the Rock Health and Wellness Center studios, like we almost always are, Monday through Friday, 6 to 7 p.m. We're live on 98.7 Walk by Faith Radio, 1420 AM, 987radio.com. We're on all of our social media pages tonight, and we're ready to rock and roll. We're going to try to be a little bit more relaxed tonight so we don't make people nervous out there. I cannot guarantee that's going to happen, but we'll try it tonight. I got a text last night said you were a little bit too intense, and I was like, well, I got a little fired up. So sometimes you're talking about health. You just want people to know information so that they know where things come from. And that's what we did last night. We got into some pretty good stuff. If you missed it, you can go back and check it out on our Facebook page or on the Walk by Faith Facebook page. You can check us out on either one of those and get that. You can go to YouTube, get all of these shows at Health from the Rock on YouTube. And that's the @ sign, not AT, but the @ sign at Health from the Rock, and you can find us there and listen to the show. We were talking about gabapentin and dementia, and we're going to finish it tonight. We're going to go through the next article and talk about it, and then talk about some things that you can do. Because you got to. I think it's fair to say, hey, look, if you got a problem, you're critical of the typical medical solution to the problem. Well, you got to have a better solution. If you don't have a better solution, I mean, me personally, that's the way I look at it. If I don't have a better solution to your problem, then I should just shut up and let you go find your solution wherever you can find it. Because I mean, don't be talking trash if you can't back it up, right? And I'm not trying to talk trash. I'm just saying that don't be critical of someone's decision because of whatever they made their decision to go do if you can't help them. So and I've lots of times I've like, look, man, I don't have anything for you. Of all the things we have in the office, I don't have anything for you. I can't solve the problem for you. And if I can't solve the problem for you, then you just got to go to the next place, right? And good luck to you. Whatever you can do, take whatever drug you need, do whatever procedure you need, go see whatever therapist you need. But that's my recommendation for you. So, but in this particular case, a lot of times I think we can do some things, and I want to share with you some thoughts tonight about some different things that we can do as solutions for these issues. And it it just kind of goes, you guys have been listening to the show for a long enough. You realize that he just says the same thing over and over again. It Dr. Chestnut said it: eat well, move well, think well. Period. It's like just narrow it down to those things. So all of this stuff basically just filters itself back down in being well. And I don't think there's a definition. I don't think there's a market on being well. I really don't. And I don't think you have to do a bunch of crazy stuff to be well. I don't think you really do. I think you could be simple and you can have a purpose. I had one of my 82-year-old guys today tell me, he's like, you know what? The reason that I want to keep living is I have a purpose. There's a reason for me to get up and go every day. There's something for me to do. And he was very specific. It's part of his club that he belongs to, that here in town. And I don't know if you guys know what Ambucks, if you ever heard of Ambucks or you're familiar with Ambucks, but man, they make these trikes for kids that are having some physical challenges, so that they can get out and be social. Number one, get out with their families. And the American Business Group, or whatever it's called, Ambucks. But let me just see if I can find a picture of that for you, because if you're not familiar with that, yeah, here's a picture. This is they're going to have their summer fest is coming up this weekend, and this is what they do. They make these bikes that are handicap accessible, basically, and they're little tricycles, and they fit the kids, and they've got like a walking handle on the back. If you need them, you can walk with them. Here's another picture, of a kid on one of these trikes. There's another kid. You can strap their feet in, you can strap their hands in, and it just gives them a chance to get out and move, and it's fantastic. It really really is a cool thing for these little dudes. And sometimes the pedals and the hands work together, and so my man that I was talking to today, he what he was saying was that he was, part of his deal is to get grants for the Ambux crew, and that drives him forward. It gives him something to do, and it drives him forward. He's like, because we're trying to get money so that we can build these tricycles, so we can get these tricycles to these kids, so the kids can move and get out and exercise and get activity and all that sort of thing. So it gives him a reason to keep moving forward, and um, and so I don't know. I don't even know what it caused me to say that, but it just talking about the alternatives to things. We don't necessarily want to fill ourselves up with drugs that are going to make us sick. We can't afford dementia. Dementia is a bad deal. I don't know if you guys have ever dealt with dementia. If you've ever dealt with Alzheimer's, I've dealt with it. My granddad passed away with Alzheimer's, and we've gone through that in our family. I've had lots of patients that have had dealt with dementia. It's a tough burden on the person that has it. It's a tough burden on the family that has to deal with it. It's a very cruel process that human beings go through. And it's like, look, if we have an article that's just plain and simple, I mean, the what we talked about last night, um, it just was plain and simple about the increase. Non-elderly adults 18 to 64 years old prescribed gabapentin had over twice the risk of dementia, 110%, and mild cognitive impairment, 150%, compared to those that were not prescribed gabapentin. And I must stress on every one of these shows, because I don't ever want it to be taken out of context, that I cannot put you on or take you off drugs in the state of Texas. That's not within my scope. Now, if you want to talk, we could do a whole entire show on how the scope of practice is developed in states. We talked about this whole book, the Blitz, yesterday, and we talked about the Flexner Report and all that sort of thing. And just so you know, because I know a lot of you guys that are on the Walk by Faith page, or listen to us on the radio, you just got finished listening to Robert Pratt talking about politics in the state of Texas. Well, that's how scope of practices are built. Scope of practices are not built on competency. Scope of practices are not built on what I learned in chiropractic school. Scope of practices are not built on my education after chiropractic school, or the continuing education that I've had over the last 21 years since I got my license. None of those things have anything to do with scope of practice. Scope of practice is done with lobbyists and congressmen in Austin that are in there to try to save their own little profession and keep everybody else out and all that sort of thing. So when I say that in the state of Texas, I'm not allowed to put you on drugs or take you off drugs, it's because the medical establishment has got lobbyists that have got persuaded senators to make sure that happened. And that's the only reason. That's what scope of practice means. It doesn't mean that the individual person doesn't know what to do. Now, in my particular case, I don't deal with that at all. I don't. I'm not a pharmacological guy. We don't do that stuff. It's not within my scope of practice, and it's not within my competence level either. I don't do that. I don't play that game. So, what did you get gabapentin for? You got it for some sort of neuropathy, some sort of pain, right? In this particular article that we went over last night, the risk of dementia following gabapentin prescriptions in chronic low back pain patients, not in neuropathy patients, not in diabetic patients, not in Parkinson's or Alzheimer's patients, but in chronic low back pain patients. So this is 26,416 adults that they looked at in this particular study. There's 26,000 people that had low back pain. And I don't even want to be I don't even want to be a low back pain guy. To tell you the honest truth, like it's the Rock Health and Wellness Center. It's not the Rock Low Back Pain Center, but it's 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 a Quigley Down Under moment for me. You guys ever seen Quigley Down Under at the very end where he outdraws the guy and he shoots him with the pistol and then he walks up to him and he said, "I didn't say I didn't know how to use one. I just said I never had much use for it." Right? That's the way I see this thing. It's like I didn't say I didn't know how to work on low back pain and get you resolved with your low back pain. I just get more excited about wellness than I do pain. So, but don't kid yourself on, I mean, like that's a whole profession. The chiropractic is the subluxation, and we ended up being back pain guys somewhere in the 60s or something like that. So, yes, we can handle your back pain at the Rock Health and Wellness Center. We also would like to handle your physical, chemical, and mental emotional stresses all together. But wouldn't you want a solution to your back pain that didn't involve a drug that's going to increase your chances of dementia by 110%? I would think that a person would. But I really think the reason that a person I really think that the reason that a person might take gabapentin is because they just don't know. Like maybe never been told that before. So you should go to your medical doctor and just ask them, "Hey, doc, have you read that study in the Regional Anesthesia and Pain Medicine Journal, July 10th, 2025, that was done by Case Western Reserve University and Arizona State University? Have you read that article? What do you think about this idea that maybe this gabapentin that I'm taking might cause me to have an 110% increase in dementia? Like, is there any other solution that I might have? Yes? Is there anything else I can do? Yes. Okay. Now that's what I want to talk about tonight. I want to talk about that was a long introduction to that whole thing, but that's what I want to talk about tonight. And I'm gonna keep it calm tonight, right? But yes, there's solutions. There are solutions to those problems. It it kind of helps if you understand what the problems are. And that's where we ended up last night talking about that. So we are going to get into that's what the show is going to be tonight. I got a couple things on the list before we get there because there's conversations, but um, I'll make a note just to know where we were. Okay, so one thing, got a message, got a text today talking about trigger finger, and I just thought I'd just bring it up. I looked at it right before I got on the air tonight. Trigger finger. You ever had that trigger finger problem where you can't your finger just will just all of a sudden it'll just bend, and you have that. We've talked about trigger finger on the show before. You got these Dufresne's contractures or whatever that is the name of that is. John Elway deals with that thing a lot. Got all this hand thing going on, and you got this trigger thing going on. Let me tell you what I've learned about that. That is coming from your gut. That is a leaky gut situation. That is a situation that I don't even have. Where did I see that today? I was just looking at that just a second ago, and maybe well, hang on. I might have it. You guys have seen it before. It was on my other phone, but the leaky gut situation. There it is, right there. Yeah, I'll share it with you. I'll share it with you, and we'll just look at it. And it's crazy because you wouldn't figure it, right? You wouldn't figure this to be like. What do you mean? Like, what is that? What does that mean? The leaky gut situation. This is a picture of the villi. Like you got these these waves of lining of your intestine. And these waves of lining of your intestine is how the food gets. Think about it, think about how you absorb food. Like if I'm going to drink some tea, and that tea is going to go down my throat, and then it's going to go into my stomach, and then it's going to go into my small intestine. It's going to wash its way down through there. How does it get inside my body? If I eat something, like if I eat a handful of macadamia nuts, how do those nutrients actually get inside my body? That they have to be absorbed through the intestinal wall. Think about that for a second. That you can't just put something in your body and it's in your body. You have to absorb it. You have to actually bring that nutrients through that wall right there in order for it to get into the bloodstream. And then now it goes to the liver for any detoxification, and then it runs through the whole system, and now you got nutrients inside your body. And the nutrients are the food that you swallow that your body doesn't want inside your body. It passes through, and then you go to the bathroom, and then you flush all that stuff out, right? That's what happens. The food comes into the top of the tube, and it goes out the bottom of the tube, and that innate intelligence becomes in play. So innate intelligence is now that system that we have that says, okay, I'm going to take these nutrients and I'm going to absorb them through that wall, and I'm going to use them, but I don't want that other stuff. That trash doesn't belong in here. I don't even know why this is in the tube, but it doesn't belong in here. So it just kind of floats on through and goes away. A leaky gut situation is when these columnar epithelium lose their tight junctions. We've talked about it before. When they lose their tight junctions, and all of a sudden they've got gaps. Like, you ever try to hold water in your hand? Like turn your sink on and put some water in both hands together, and then what do you do with your fingers to keep the water from leaking through your hand, right? Or if you're trying to get a drink or something, or you want to wash your face off, how do you keep the water inside your palms? You keep your fingers really tight together. What happens if you open your fingers up and you put your fingers underneath the water and you try to cup the water with your fingers? The water just runs right through there, right? Now, I didn't break my fingers off. I didn't destroy my fingers. But what if I don't have the ability? What if I don't have the ability to keep those tight junctions? Now just think of it, what happens for a second. Think what happens with food that is floating through your digestive tract that is not supposed to be in the body, but it leaks through there. It leaks, it leaks through there. Like, what if I poured bleach in your hand and you had to carry the bleach across your living room and pour it out into the sink in the bathroom? And you were like, dude, I don't want to drop any of this bleach and get it on the carpet or on anything else, right? I got to keep it all there. But what happens if you spread your fingers out and the bleach drips down on your carpet? It ruins your carpet, right? That's what happens with leaky gut. Is you get particles of food that weren't supposed to be in your body because you've lost that tight junction, and now you can cause a leaky gut situation. And that sets off an alarm. That sets off the immune system. What did we say last night? Last night, the inflammation is the initial stage of the immune system. Well, now we got the immune system response. And what is the brain going to tell the body to do? What is the body going to do with that particle of food that was never supposed to be inside the vessel? It was supposed to have washed through, except we have a hole basically in the lining of the intestine. So what is that body going to do? The brain and the nervous system and the immune system is going to say, keep that as far away from my heart and brain as possible. Do not let that get close. And what does it do? It pushes it to your hand. It pushes it to your hand, and now your hand becomes malfunctioning. You get osteoarthritis in your fingers. You get these big swollen knuckles on your hand. You get that old arthritis term, right? You get arthritis in your hands, and you get these malfunctioning tendons that'll cause that whole trigger finger to um, happen. And so, man, I tell you, the first time I heard that, I did not understand it. I was like, it was Dr. Guest taught us that when I was in chiropractic school, and I did not understand that. I was like, what is he talking about? Like, what? Like, is like my gut? The problem with my hand is coming from my gut, and I didn't know. I didn't know about it. But I got to practice, and early in practice, I've told this story to you guys. Early in practice, I had a guy that could not bend his middle finger. Like it would just pull. He would pull his fingers down, but his middle finger would stay up. Looked like he was flipping you the bird, and he couldn't get his finger. There was no contraction in that middle finger. And I told him, I said, look, I said, you can, all I can tell you is that Dr. Guest told me that's coming from your gut. And if you do the 21-day detox program, you would solve that problem. And he did. And on day 11, he walked in the office and he made a fist. And he's like, look at this. And he's like, would you please explain to me how that happened? When you're first in practice, when you're new to practice, you don't have enough clinical experience. You just have to take the word for the guys who came before you. Right? You just have to take their word for it. It's like, well, Dr. Guest told me that would work, and I don't have enough clinical experience to know that it would work. So I just had to go off of what he was telling me. And he was like, explain to me why. It's like 2 years he couldn't bend his middle finger. And then he just walked in and he just made a fist. And then his hand worked. And I was like, well, let me tell you what I think it is. But based on what I've been taught, and that's what I told him right there. I showed him that picture. There's leaky gut, puts it in the hand malfunctions. There you go. So that was one of them right there. That's one of the conversations that we had. And there's one more conversation that I wanted to talk about tonight because and let me get us off of this leaky gut thing here. If you got any questions about that, I'd be glad to answer them. You can text me 806-794-0400. You can send me a message on social media. You can call me sometime and talk about it if it's too foreign to you or it doesn't make any sense. But skin conditions are the same thing. Matter of fact, eczema and all that sort of thing is coming from your gut. Go look at your gut first. Get your gut cleaned up, and then you'll solve that problem. Okay. The further you go in life, the the less, and this is coming, you got to understand, this is coming from a 54-year-old guy that's observing things, not living it out personally. I've never made it to 60 yet. I haven't made it to 70. I haven't made it to 80 or 90 or 100. So I'm not speaking on personal experience. I'm simply speaking on observational experience of, especially after 21 years of having, or, I'm in my 21st year of having a license. I'm seeing things as I get older and I'm observing things. Okay. I just want to present for your consideration as you get older that you have to protect against the thing that's going to get you down. Okay. The surgery that's going to knock you off your feet, the fall that's going to knock you off your feet, like whatever the thing that might be that takes your energy away to the point where now you just feel like you just need to sit down and recover, but you sit down and recover and then you lose more energy, and then you sit down and recover and you lose more energy, and then it's like all of a sudden we've created a snowball. And I'm very sensitive about that with my older patients. And I get a little protective, and I'm not going to apologize for it, but it's not necessarily mature that about people talking. When I was coaching wide receivers at New Mexico State, or I was coaching defensive tackles at Texas Tech, I hated it when people on the sideline coached up my guys. And there's a bunch of people on the sideline. You always had some guy standing over there on the sideline, the punter or something, was always wanted to give your guys like advice. And I'm like, would you leave my wide receivers alone? I've been coaching these kids every single day. Some of them I've been coaching every single day for 3 years. Like, they don't need to hear that nonsense because it doesn't affect, it's not related to what we're doing in the moment, and it doesn't fit the big picture of things. So you get a lot of advice from a lot of people, but you got to, I really want to present for your consideration, move your feet, get on your feet. Missing your workouts, missing your exercise, staying seated. I'm not saying that you shouldn't recover from things, but like we have a little bit of a scenario. We talked about it today, but one of my ladies had a little procedure done, and then she came back to work out, but I wouldn't let her lift anything. She wanted to do a little bit more of the workout, and I said, no, I just want you to ride the bike. Just get up on the bike and move your feet, and that's it. And she probably rode the bike at 8 miles an hour or something. Like, she's just barely moving her feet. But she was in her routine and she was going and all that sort of thing. And then she lost her energy a little bit and she talked to some people. And then all of a sudden she's like, well, I think I'm supposed to take off for 6 weeks. And boy, that just got all over me. I'm like, nope, don't take off for 6 weeks, because you take off for 6 weeks, you may not ever get back up. That's you're when you get you get over 75 years old and you got to take off for 6 weeks, you got to get back on your feet. You really, you run the risk of never getting back up again. And I don't want that to happen to anybody. So I just wanted to have that conversation with everybody, just to say, listen, got to protect those things when you get older. So, all right, we're out of time for this segment. We got to take a break. When we come back, we're going to talk about the sister article that goes along with the Gabapentin thing, and we're going to talk about how chiropractic actually helps and why it helps and what's going on and how you can solve this pain problem. We'll be right back. If you're new to the show, we are taking a break right now. We've got, I'm listening to our radio commercials from 98.7 Walk by Faith Radio right here in Lubbock. And we do a live show. So we're doing a live radio show and a live social media show at the same time. And so if you're new to us, that's what we're doing. If you're not new to us, thanks for sticking around for this long. One of my guys told me today, he said, Doc, you just started talking about something last night that was too confusing to me, so I just turned it all off. I just went to bed or whatever. And I was like, fair enough. I totally understand. Like, we tried to bring something to you that you might learn, I think we're getting better as we're going along, but 5 nights a week for an hour is a lot of content. There's a lot of things to talk about, and I know that a lot of people have other things to do. So, if I'm just here, and to tell you the honest truth, how we come about this, I actually got this idea from Grant Cardone. I don't know if you guys know Grant Cardone. He's a little bit of a character, and he's kind of hard to take. But first time I heard him, I turned him off because I thought, this dude's so cocky. And then about a year later, I turned it back on, and then I listened to him a little bit. But he did a show every day. He did a show like from 12 to 1. It was over the lunch hour. He did a live show 5 days a week for an hour. And I thought, man, so when Walk by Faith, when they said, hey, would you like to have your own show? Because I did it for 2 years. I did it with Ken Adams on the Thin Line with Ken Adams. And then they said, do you want your own show? And I said, yep. And they said, well, when do you want it? And I said, well, I want it right after Robert Pratt on the radio, which is 6 to 7. He goes from 5 to 6. I said, I want it right after that, because that's really the only time I'd have a chance to do it during the day. And he said, which nights do you want to do it? And I said, every night. I'm like, we're going to talk about it. We're going to talk about it every night. We're going to talk about health. So that's what we do. We talk about health. Sometimes we just repeat the same thing because there's only so much stuff that I know. And if you've been hanging around watching this for 2 years, you probably like, I've gotten all that boy has to offer. But every once in a while, we mix it up a little bit. So hang on. Okay, everybody, we're back. This is Life with Jason Clemens, DC, and we're going to get after it now. So we're going to talk about this next article. Okay, we talked about the one about the risk of dementia. And so now at the bottom of the article, Dan does a good job Dr. Dan Murphy, he's one of the guys that um, he's kind of a mentor of mine. He doesn't even know it, but I've been to listening to Dan since 2009. And what he'll do is at the bottom of these articles, he'll reference an article review. Like he said, we have also reviewed this article related to gabapentin and chiropractic care for radicular low back pain. And this was an article review in 2024. And I think we've gone over this. I think we just went over this um, a few weeks back, but we're going to do it again in this filter. We're going to do it in the so we're going to look at it and we're going to replace that one with this other article and move this one out of here. There we go. So because I want to give you a solution to your low back problem that is like, hey, look, does it work, right? And last night we started in on it a little bit because we got to the inflammation part of it. How do you control pain? What do you do to control pain? Where is pain? How do you control it? What can I do? Have you ever heard of fish oil? You have, because you've listened to me, you've heard. But if you're new to the show, fish oil. Why fish oil? It gives your cells the best opportunity to function at their highest level. That's it. Like let's start with that. That's the number one thing. Let me write it out for you. Um, this the reason I love fish oil and I'm a fan of fish oil is one simple thing. You have a mitochondria, and the mitochondria produce ATP, which is the power of the cell, the fuel, and to make a real short story, omega-3s protect the mitochondria. Now, if you want to have a great evening and you want to study some stuff, just Google mitochondrial dysfunction. Just start in on it and say, what diseases are a result of mitochondrial dysfunction. You can spend the rest of 2025 breaking that down. So that's the number one reason that I'm a fan of fish oil. Okay, the number two reason I'm a fan of fish oil is if we're talking about, I was just reading this article right here. I was looking this over, and let me see if I can. There we go. Because whoa, what did I just get? Hang on. There we go. Let me just show you this picture, if I'm talented enough to pick it up, because this is just one picture that I had in my notes that was talking about inflammation, and it goes along with this right here. It says all forms of inflammation. This came from one of my Dan Murphy seminars. All forms of inflammation, including silent inflammation, are ultimately controlled by a group of hormones called eicosanoids. And I heard eicosanoids for the very first time from Barry Sears in the Zone Diet back in 2000. It's the first time I heard that word, eicosanoid. It is the balance of eicosanoids in your body that is the ultimate key to wellness. All eicosanoids are ultimately derived from dietary fat, in particular, the polyunsaturated essential fatty acids that must be supplied by the diet. Virtually all chronic diseases can be viewed as a consequence of continuing imbalance of good and bad eicosanoids. The arachidonic acid to EPA ratio will tell you the extent of silent inflammation in your body. That was in my notes, and I've had these notes for a long time. Let me say it again. Virtually. Now, when you say something like that, you leave yourself open to a lot of criticism. I want to make sure that I'm saying it from the standpoint of wellness. From the standpoint, like, look, as a wellness guy, if I had to get down to one thing, I say it all the time: control your insulin, balance your 6:3 ratio. Control your insulin, balance your 6:3 ratio. What? Why? Why? Because of sentences like this. All the carcinoids are ultimately derived from dietary fat, in particular, the polyunsaturated essential fatty acids that must be supplied in the diet. Virtually all chronic disease can be viewed as a consequence of continued imbalance in good and bad carcinoids. So, what does that mean? That means that your body's going to get inflammation based on the omega 6:3 ratio. And I'm really not trying to get back into omega 6s and 3s again, because you guys have heard this forever. Like omega 6, uh, sorry, sorry. There we go. Omega 6, huh, if I can draw it, and omega 3. All right. Omega 6 is inflammatory. Omega 3 is anti-inflammatory. It's that's where you get your carcinoids from. That's what they're saying. That's what that sentence said. It's like when you have a high level of omega 6s in your body, you kick off this eicosanoid that is an arachidonic acid based consequence that goes down to this prostaglandin E2, and that's your inflammation right there. That's one way that you can control inflammation, is balance that. This right here blocks omega 3s, block the conversion of arachidonic acid to prostaglandin E2. It changes the pathway metabolically to decrease your inflammation. So, what we're talking about is you've got low back pain. You've got, in some form or fashion, you've got inflammation in that. Something's inflamed. Either the nerve root is inflamed, the disc is inflamed, the soft tissue around it is inflamed, the fascia is inflamed. Something is inflamed down there that is causing this irritation of that nerve. Okay, so it may not be the only cause of the back pain, but it is definitely one of the causes of back pain is the inflammation. So, what can I do to decrease my inflammation? And as the article said, silent killer, right? One of the things is that you don't even know what's going on. We want to control our 6:3 ratio. Basically, being very simple, how do we do that? We decrease the number of omega 6s we eat, and we increase the number of omega 3s we eat. That's how you get your 6:3 ratio to balance. When you get your 6:3 ratio to balance, it neutralizes the eicosanoids and it neutralizes the inflammation. It brings the level of inflammation down, right? That's one of the things that we can do, and that's where the fish oil comes in. And because what's important on a bottle of fish oil? EPA and DHA. EPA and DHA. DHA works in your brain. EPA balances arachidonic acid. So that's what the article that we just looked at said. That picture, it what it just said was the the arachidonic acid EPA ratio will tell you the extent of silent inflammation in your body. You take a little finger prick test, you drop a piece of blood on an envelope, we send it off, they test it, they send it back to us, and they tell you what your arachidonic acid to EPA level is. One of the things that causes leaky gut is increased inflammation in your gut. It's like kids that colic on formula. It's like formula is corn syrup solids. It's like 50 something percent corn syrup solids. Corn syrup is high in omega 6. Corn chips, peanut butter, seed oils, all those things are high omega 6s. If you get your omega 6-3 ratio out of balance, you're going to increase your inflammation. Okay? And I'm sorry, I didn't mean to talk about that so much, but what we're talking about is trying to avoid you having dementia or cognitive impairment because you took gabapentin for your low back pain. That's what we're really that's really what we're trying to talk about tonight. Sometimes it doesn't seem like that's what we're doing, but that's what we're doing. Okay. Here's the article. This comes from the British Medical Journal, Open, July 21, 2023, volume 13, number 7. Association between chiropractic spinal manipulation and gabapentin prescription in adults with radicular low back pain. This was done by just a group of people. The study cites 79 references. The study was the first to examine the association between chiropractic spinal manipulative therapy, the adjustment is what we'll call it from this point forward, and the likelihood of gabapentin prescription among patients with radicular low back pain, meaning it hit the nerve root. Now you got something going down your leg. Participants were adults aged 18 to 49 who were having their first episode of this low back pain diagnosis. Their mean age was 36 years and 60% were women. So your back hurts, right? Their mean age was 36 years. Let's talk about 60% of these were women. Let's talk about a 36-year-old woman, right? What's typically, I'm not trying to be stereotypically or chauvinistic, what's typically going on with a 36-year-old woman, right? Has this woman more times we probably got some sort of marriage involved in this deal, right? We probably got some sort of kids involved with this person. A lot of times has been through labor. Now this person's working a job. That's what I call the big three. That's the three big stressors. You got a husband, you got kids, and you got a job. That's three full-time jobs, 24 hours a day. The measly one that you work is only 40 hours, but the other two are 24 hours a day, 7 days a week, right? And now you start to get to the point where anything you get into your mid 30s and any of your structural faults start to show up. You get in your mid 30s and maybe you went to work, maybe you're a professional. Maybe you don't have kids and you don't have a husband, whatever. I'm not trying to get in a fight. I'm just saying that it's very common that you get into this part of life, but you're a professional. I just talked to one of my professionals that works with little kids with learning disabilities. And she was like, I feel like she's like into her late 20s now, maybe early 30s. And she's like, my neck was hurting this weekend, but I always feel like I'm leaning forward, like my body is going forward. And I'm like, your body is going forward because you're working with the kids that are down there, right? And any structural fault that a person has starts to show up in this period of time. That it's like, okay, now your back hurts. What are you going to do? Where are you going to go? You're going to go to your doctor. Your back hurts, so you go to your doctor. What's your doctor going to do for you? Your doctor's going to say, well, here's some gabapentin. Like, take this. And I'm not making that up. I'm just reading the article right here. Key points from the article. The USA is the leading age standardized prevalence of low back pain in the world. Together, low back pain and neck pain account for the leading causes of medical expenditures in the United States. I'm not making that up. British Medical Journal is. Radicular low back pain is often treated off-label with gabapentin or by chiropractors using chiropractic spinal manipulative therapy, the adjustment. Radicular low back pain, which involves a nerve root lesion, a nerve root is involved, considered a type of neuropathic pain and involves radiating symptoms into the same side lower extremity. So, what do you get there? You get that distribution of pain into the lower extremity. Excuse the picture, but now where is it going? And you guys have heard me talk about this one a bunch, But where is the see, I got too many tabs open right here. Where is that pain going? Sorry. Can't get to my picture. There. All right. I need a manager. Sorry. Okay, I got it right here. You got pain. You're hitting that nerve root in your low back, and now you're feeling it in your leg. You're either feeling it coming around to the front of your thigh, you're feeling it run down the inside of your leg, you're feeling it come down the outside of your leg, it's going down into your foot. You've got some sort of distribution in your leg. You're feeling that. It's like, oh my leg is just killing me right here. It's just running across my thigh, right? That's what this article is talking about, that you have a nerve root that you're hitting, and it's causing radicular pain that's going down the leg. That's what this is saying right there. Radicular low back pain, which involves a nerve root lesion, is considered a type of neuropathic pain and involves radiating symptoms into the ipsilateral, which means the same side, lower extremity. Non-radiating low back pain resulting from myofascial, discogenic, sacroiliac, or zygapophyseal joints, your facets, is considered nociceptive and does not necessarily radiate to the lower limb. Yeah, so you're going to get some radiation in some of that, but you could have localized pain, or you could have pain that's running down your leg. Either one, right? Gabapentin is an anticonvulsant, anti-epileptic medication used as first-line therapy for several types of neuropathic pain, including diabetic neuropathy and herpetic neuralgia. Gabapentin may alleviate neuropathic pain by binding to a subunit of voltage-gated calcium channels, subsequently inhibiting the nerve discharge. It's been used off-label for low back pain. It has U.S. Food and Drug Administration approval since 1993. Systemic reviews in 2018 and 2022 demonstrated clear evidence of lack of its effectiveness for radicular low back pain. I don't know all of the studies. I'm just reading those two. There is a growing evidence of risk associated with gabapentin use, including abuse, misuse, dependence, and withdrawal. Other deleterious adverse effects of gabapentin include excessive sleepiness, dizziness, ataxia, can't walk good, fatigue, and new onset weakness or lack of energy or symptoms. So it's not free. The only thing, what I'm trying to say is that it's not free of side effects. Like, there's something to it right there. Okay. Now listen to the other part of this. Chiropractors are portal of entry providers in the United States who frequently treat spinal disorders. What does that sentence mean? What does portal of entry providers mean as a chiropractor? What portal of entry means is that I do not need a referral for you to come to my office. I don't need anybody. Now, you may have an insurance policy that requires you to get a referral, but that's because that's between you and your insurance company, not between you and me. So that's portal of entry means anybody can walk into my office for any problem. Now, it's my responsibility to know whether or not I have the scope of practice to handle that problem. Like, is it within my, is it in my game to handle that problem? If it's not, then I have a responsibility to send that patient to the proper provider. And that's what we do. If you come in, I've had that a few times. That I had a girl one time that came in with I don't know, it's like almost a volleyball-sized tumor in her back. And she came into the office. She was a young teenage girl. She came into the office and she sat on the table and she said, "My back is hurting." And her color was yellow. And I was like, "What's the matter with you? Like, what's going on?" And I ran my hand down her back, and I could just feel like that it was wrong. I didn't know what it was, but it was wrong. And I said, "Do you have a medical doctor?" And she said, "Yep." And I said, "What is her name, or what's their doctor's name?" And she told me it was a girl. And I left the room right then, and I walked straight into our office, and I got on the phone, and I called this medical doctor, and I said, this office, and I said, "I've got this girl in here, and I think she needs to be seen like right now. I think she's got a problem, and it's not a chiropractic problem. It's not a subluxation issue. There's something. Her color is wrong, and she's got something going on in her back." And this girl got sent to her. She went to her medical doctor either that night or the next morning, and the medical doctor actually called me and told me, she's like, "You actually saved her life. She had a volleyball-sized tumor. It's kind of and it was pushing on her organs, and she went into surgery the next day and had that tumor removed." And it was really cool because she came back a few years later, and she came back and came to see me, and she was like, I didn't even recognize her when she first came in, because I probably only saw her for 15 minutes. And when she came back in, and she's like, "You remember me?" And I was like, "No." And then she told me, I was like, "Yeah, I remember you now." And so that was a cool story, right? The only point I'm trying to make is that's what a portal of entry doctor is. I don't need anybody's permission to see you. You can come see me. If what you have is not a chiropractic problem, we'll send you to wherever you're supposed to go. Okay. When treating radicular low back problems, these providers often use chiropractic spinal manipulation, the adjustment, a hands-on treatment directed to the joint of the spine. Yes, we broke that all down last week with Heidi, with the high velocity, low amplitude adjustment and what it does neurologically and how it resets things. Yes. The adjustment is supported by systemic reviews and recommended by clinical practice guidelines for the treatment of low back pain. Studies have found that the initial type of providers seen for low back pain influences the subsequent likelihood of receiving a prescription for certain medications. That sounds like such an obvious sentence, but it's not something that you actually think of. I can 100% guarantee, if you come to me first, or well, I can't say all chiropractors because some of them give drugs now. They have nurse practitioners in their office. If you come to me first, I could guarantee 100% you're not going to get a prescription medication from me. You'll have to go to your doctor to get a prescription medication. If you go to your doctor, there's a very, very, very high probability that you're going to get a prescription medication. And so studies have found that the initial type of provider seen for low back pain influences the subsequent likelihood of receiving a prescription. Of course it does. Because if you go to a guy and his toolbox is full of pharmaceuticals, he's going to give you a pharmaceutical. If you go to a guy whose toolbox has no pharmaceuticals, he's going to have to do something different for you. So patients initiating care for low back pain with a chiropractor compared with other providers have reduced odds of receiving opioids or benzodiazepines as prescriptions. Yeah. Disc degeneration and spondylosis may cause axial low back pain without radiculopathy. That's why we do x-rays. We do x-rays to look and see what's going on there. What could be the problem that is causing your issue? We also do a physical exam. We also examine your brain. We're trying to figure out why you're having this problem. And that's where it gets really tricky, because when you do an x-ray and you do have degeneration, it's a trap to look at those two things and marry them together. You have low back pain and now you have an x-ray that says you have degeneration. I'll just say, well, the degeneration is causing the low back pain, which it's not. It's not true if your low back just started last week. Your low back started 3 days ago. Your low back started hurting 2 weeks ago. If your low back 3 weeks ago was fine, you didn't have any back pain, then I can promise you it's not because of the degeneration, it's because of the function, right? Neuropathic pain is more common in those with low back pain related to lumbar disc herniation compared with lumbar stenosis, scoliosis, or spondylolisthesis. So when that disc bulges, it causes all kinds of disruption in the area. So what is the findings of this? What's one thing? We talked about inflammation. Definitely you could do that. What are the findings? Gabapentin prescriptions was less frequent in the adjustment cohort over 1 year follow-up after the low back pain diagnosis. After matching, odds of gabapentin prescription over the 1 year follow-up were significantly lower in the adjustment group with um, receiving the usual compared with receiving the usual care by 47%. It's 47% less likely to end up with gabapentin if you get adjusted for this problem, which means that you're 110% less likely, or you have a 110% increase if you're in this age group to get dementia from taking multiple gabapentin prescriptions over a period of time. And that's basically the big deal. These real-world findings support our hypothesis that adults initially receiving adjustments for low back pain have reduced odds of receiving gabapentin in their follow-ups. That's all I got for you tonight. I'm out of time. We may step on this just for a second and finish up the rest of this, but we'll just keep talking about health tomorrow night at 6. Thanks for watching the show. Please let me know if there's anything I can do to help. And otherwise, you guys have a great evening.